Hi, I'm Mayor Tim Balderman, and I'd like to welcome you to this edition of Community Business Spotlight. Joining me today is Mary Beth Antone. She is the Administrative Director of Imaging and Cardiology for Silver Cross's Women's Healthcare Center.
Yes.
And a few other things you do as well, I think, correct?
Exactly, yes. I am the Administrative Director for Cardiology and Imaging Services at the hospital. And the new center, Silver Cross Center for Women's Health, which is located in the medical office building on our replacement hospital campus.
Yes.
I am the Administrative Director over that area as well.
That's wonderful,
Yeah,
yes. Unfortunately, I'm there on a regular basis seeing my doctor, but
oh, that's okay. At least you're getting there.
Oh, I am, and he's a great doctor, and it's a beautiful campus. It's coming along very well.
Oh, it's actually, I drive by there every day on my way to work, and I am super excited. It's a beautiful, beautiful campus. And the Silver Cross Center for Women's Health has been there since we opened in October.
Okay.
And the reason that we decided to locate those services there prior to the hospital coming on board is because we all know women make a lot of healthcare decisions. Right. And we wanted to create a site where women could receive their healthcare services in advance of our hospital getting there.
Sure.
So that by the time the hospital moved, they'd say, wow, I've been there, it's fabulous. And it's kind of giving this new community that we're in a glimpse of what Silver Cross has to offer.
No doubt.
Yeah.
Talk about some of the services that you do provide here.
Okay, in the Center for Women's Health, we are basically, our core business is women's health imaging. So it's mammography services, bone densitometry. These are the kind of annual screenings that women have. And in addition, we provide some screenings. We do baseline cardiac screenings so that women can look at both areas of their health that are things that they can do about in advance of getting a disease. So mammography services, both screening and diagnostic. We do biopsies there as well. Our goal from a women's breast health perspective is to have it be one-stop shopping.
Okay.
So if a woman comes in for a screening mammogram and has an issue, if they choose to and their doctor gives the okay that day, we can get them through the full complement of services during that day. So screening services, diagnostic services. We also are very fortunate currently to have a couple doctors on staff from the University of Chicago, women specialists. We have a urogynecologist who is there twice a month, and an in vitro reproductive endocrinologist, a doctor that does in vitro fertilization for women who have difficulty with pregnancy. So those are the core businesses that we have. Some of the things that we do that are kind of fun in the community is we host what we call a series of girl talks.
Okay.
So the center is absolutely beautiful. We have mammography rooms. It's set up like a spa. It's absolutely gorgeous. And we have a small intimate waiting room where a couple times a month we have doctors come in and do very informal lectures, if you will, but really discussions with women about issues related to women's health. We have a breast cancer support group that meets on the fourth Tuesday of every month. And we plan on doing additional services as the need arises in the community. So if community members have ideas on what they'd like to see us offer, they can give me a call or call the hospital.
Sure.
That's pretty much a lot of what we do.
And that's an awful lot that you provide.
Yeah.
Now women, of course, everyone has health issues that they deal with, but women in particular have some specific to them,
right?
From very young ages all the way to elderly.
Exactly.
Do you provide services for every stage of life there, or is it? Well,
in the Center for Women's Health, we concentrate on those women that are of mammography age and older.
Okay.
But what we're seeing in the healthcare community is that breast cancer is very much on the top of women's minds.
Sure.
And women who have family members, mothers, grandmothers, aunts who have had breast cancer are learning that it's a good thing early on in their stage of life to look at that. We do not do obstetrical services. As a women's health care center, we leave the obstetrical services to those specialists that do that in their offices. So it's really primarily the breast health services that we offer.
Okay, and let's talk a little bit about, and there's always this discussion about how often should someone have a mammogram? At what age should they start having the mammogram? I mean, what's the latest information that you have?
Well, there's a lot of controversy out in the community now because, as you know, the U.S. Preventative Services Task Force came out with some recommendations that rather than annual screenings, women should have them biannually and starting at a later age than they do now. There's a lot of controversy out there now. I don't pretend to know all the specifics. What I do know is that we have seen a significant reduction In breast cancer, since we started doing annual screenings, women are more in tune to wanting to have those things done and catching these diseases earlier. There's greater survival rates when they are diagnosed with cancer. We like to see women have annual screenings at the age of 40. We accept anyone who comes in with a prescription from their doctor for a mammogram. We have digital mammography. This is the latest technology whereby when the film is taken, it's not really a film, it's a digital image on a screen that the minute the image is taken, the on-site radiologist, we actually have a radiologist who's sitting in the back in front of a screen, can see that immediately. And he can read it and he can say, oops, I see something, maybe you need to take another image, as opposed to developing a film, walking it back, et cetera, et cetera. So we have the ability to provide that service now and have women get the whole shebang. If they needed a biopsy, we could do it right then and there.
That's amazing, because anytime you have a health issue, I don't care, man or woman or what it is, the worst part is the waiting for the information. What are they going to find, if anything? And then if they say, well, you know, we see something, but we're not sure, come on back in and go through the process all over. So that really is great technology that you're utilizing there.
We have the technology, but we also have a unique person's role in the organization. We have a registered nurse who's actually a certified breast nurse specialist. There's only 300 of them in the country.
Wow.
We're fortunate to have one at Silver Cross. She stays at the center and she actually helps women make these decisions on the spot. You know, she will come in and explain what the results were, make recommendations to help guide that woman to receive the appropriate care for what her physical ailment is and kind of where she's at emotionally. Oh, I don't know, should I have that done today or not? So her name is Netta, and she is fabulous. She is there at the center, and she will help that person connect all the dots in her care. Some people call that a liaison, and we like to just call her like this nurse that's there to help you.
Sure.
And that's been a tremendous boon. We have a beautiful facility that is very spa-like. It almost kind of makes you forget that you're even there for your health, but then she can reel you in if you have issues that need to be followed up on.
Okay, now talk a little bit about education, especially when you talk about cancer and genetics and it being passed, you know, or something that runs in family histories. How important is it, if there is that family history, of getting in and getting screened, and not only that, but educating people at a younger age what to look for?
Right. We actually have in the center a library, and we call it's called the iMatter Library. We have a program called iMatter. We partner with businesses in the community to reward women for having their health screenings done. We have business partners who are iMatter business partners, whereby if a woman comes in and has a screening done, she can then receive a discount to receive discounts at this, a discount card to receive discounts at these businesses. So we basically said to our iMatter partners, could you help us and allow us to name this library after you? iMatter Library, you can come into the center. We have all kinds of paper resources, but in this day and age of electronics, we have a computer there where anybody can surf the web and find out information, and then we have clinical experts on site who can answer questions. We encourage women to always speak to their physicians. That we don't ever want to interfere with the physician-patient relationship. So get the information that you need from your physician, get those diagnostic tests ordered, then get to us, and we will spend as much time with you as you need to educate you about what your particular issue is.
Yeah, that's fantastic. There's nothing more important than our health, and certainly what you're doing there in dealing with women's issues in breast cancer and that. You know, it's affected so many people in life. Anything that we can do to try and curb that is important.
We're very proud of what we've done at the center, and we also, I should mention, we do have a website. It's imatter.silvercross.org, where women can go on. We have a blog, all kinds of educational information, updates on what activities that we're providing in the community, an explanation of the services that we provide, and then information on how to access the Center for Women's Health.
Well, that's wonderful. We are certainly grateful to have Silver Cross Hospital being built in our community, the medical office building, which of course houses your center and others. Fantastic, not only for New Lenox, but the entire region. So we would encourage women to get in there and take care of their health, because God knows men can't make it without you. So,
well, we do have men come on occasion, you know.
Sure,
so, yeah,
absolutely. Anything else you'd like to add about the center?
No, I think that's it.
I think you've covered it. You've done a great job. Well, thank you very much for being here today.
Thank you for having me.
And thank you for bringing these services to our community. Certainly, I know we all appreciate it.
Awesome. Thank you.
Thank you
very much.
And I want to thank all of you for watching this edition of Community Business Spotlight.